Hi, I'm Enrico Stazzone, a Pediatric Orthopedic Surgeon. I was going to be an engineer, actually. I was heading down that path, and a very dear friend had a bad accident, and this was in high school, and ended up paralyzed, and that was kind of really an event that made me think about, instead of going into engineering, maybe going into something more in the medical field. I was on my psychiatry rotation, and she came up to me and said, "You know, you're really good with the kids. You get down on the floor and you play with them and you interact, and you know, have you thought about going to pediatrics?" And at the time I was like, "Nah, I'm already set on going into, you know, orthopedic surgery, bones and joint surgery." And so, and that was really the first one who really made me think about, well, maybe I should kind of subspecialize in pediatrics. And then I started a relationship with one of the pediatric orthopedic surgeons at Columbia, David Roy, phenomenal person. And then I was hooked, you know. Then I knew that's what I wanted to do. I think from a patient standpoint, I think they should know that, number one, that we care, and number two, that they're going to be heard, and we're going to try and understand how this is really affecting them. When you see someone who's really, you know, really having some struggles, and you can kind of, you know, put a diagnosis and name on it, sometimes that gives them some peace. And then as they start to heal, and all of a sudden, things that before were painful or not possible, all of a sudden they can do things that before were not possible, you know, and you see that smile on their face, you know, and then, you know, and sometimes it's medical stuff, sometimes it's just non-medical. I was contacted by two young spine surgeons in the Dominican Republic, in Santiago, and they had just recently finished their training, and they wanted to start a program there to help children that had spine deformity, scoliosis. And they really had a heart. They really wanted to help the children of their country, but they just needed a little bit of, you know, help to set it up. So then we started building a program. So we got implants donated, we put together a team, and so we bring down a full team of OR nurses, ICU nurses, ICU physicians, anesthesia physicians, neuromonitoring specialists, and we basically tried to make it as close to how we would do surgery here in the United States as we could, even though we're in the developing world. It's been a beautiful experience the last several years. I mean, it's kind of why you go into medicine. You go in just to help. I've got 3 boys, 17, 18, and 20, and then my daughter's 11. So we like to travel. We like to do things where we're active. So my boys all like to snowboard. My daughter likes to ski. And then lately I've been doing more and more scuba diving, so I like to do that when I have some free time. Not a lot of free time, but when I do, those are the things I enjoy.